Scanning is used a lot in medical situations, and these are used to eat common things like bone breakages, but also disease progression. And often these scans need to be calibrated so that density of different body tissues can be calculated. Typically, this uses density phantoms that are synthetic materials of known density. These are scanned alongside specimens, and then from that you can calculate the density of things like the bone. New techniques have been developed called phantomless techniques, and these mean that you can use other body tissues to calibrate the scans. So things like bone pathologies, you can use blood, fat, muscle tissues to calibrate these scans. Now, in archaeological material, paleontological material, and osteological material, there's typically no soft tissue, so these methods are not applicable. So in a new study, we wanted to see if dental tissue can be used for this purposes. Now, this is using micro CT scans like this one here. These are higher resolution than the CT scans. And from this, you can look at, you can create 3D models of fossils, of archaeological material. But typically, the density of the actual bone tissue is not studied. It's just used to create these 3D models. So we wanted to see if, especially in archaeological material, teeth could be used to calibrate these scans. So we had a large sample, including archaeological human samples, as well as clinically extracted human teeth. And the aim was to see if the variation in mineral density of these dental tissues, so enamel and dentine, is small enough that these can be used for calibrating for bone. And the results published in the American Journal of Biological Anthropology, we found that there is very little variation, as long as very particular areas of the tooth crown is studied. Things like the outer enamel can change through the life of an individual, and close to the pulp chamber can also vary across an individual's lifespan. So as long as these very particular areas of the enamel and dentine are recorded, it's a reliable method for calibrating micro CT scans. So the idea is that this can be used for paleopathology, so to look at health, disease, behavioral practices of past populations, but also can be used in evolutionary studies.
And you vary the region of interest that you collect the data from, depending on the thickness of the enamel. So I'm going to run through an example using a baboon, and we used ImageJ or Fiji for this, and you use the circular region of interest, and roughly there's half the size of the enamel thickness using the buccal and lingual average. So in this case, you put it roughly here for the starting on the buccal of the mesial cusp. So we always use the mesial cusps in all the samples. And you want to avoid any scanning artifacts, things like ring artifacts, or in this case, there's some postmortem cracks that have formed in the tooth. So you want to avoid things like that. And for the dentine, again, it's roughly halfway to the middle of the tooth, or if the pulp chamber is visible in the slice, roughly halfway to the pulp chamber. And you do the same for the lingual, and then you then do it for 4 more slices, so a total of 5 slices. So 4 values for 5 slices, so 20 values in total. And from this, you'll find the average value for the 10 enamel values and the 10 dentine values. So you click on measure in ImageJ, and then you just find the average value for each. And then from there, you want to click on the calibrate function within ImageJ, and then you give the average values, the average grey values. So in this case, it's roughly 130 for the dentine and 210 for the enamel. And then you use the straight line function, and this is grams per the cubic centimeters, the unit. And again, when we did the 70 samples for this study, there was remarkably similar values across the samples. So the average was 1.27 for dentine and 2.25 for enamel. And the standard deviation was under 0.03 across the samples. So there really is, as long as you use these particular areas, very little variation. And then you click on global collaboration, and then you click on OK. And now the scan is calibrated for mineral content.